Welcome to Mediquap's masterclass. In today's masterclass, we'll be learning muscles of mastication. Now, this muscle of mastication, it's highly important from exam point of view as well as from viva point of view. Okay, so let's start with the topic muscle of mastication. So, as the name indicate, muscle. Okay, so we are talking about muscle of mastication. That is the muscle which are responsible for your mastication. That is chewing of the food. Now let's see the introduction. So as I said, these muscles of mastication, they are responsible for the chewing movement of mandible or the lower jaw, and they originate on the skull and insert on the mandible, acting on mastication and movement of the lower jaw at TMJ. Now there are 4 masticatory muscles, and namely they are lateral pterygoid, medial pterygoid, temporalis and masseter muscle. Now examiner can ask you what are muscles of mastication and briefly describe the muscle of mastication. So the muscles of mastication, they are a group of muscles that consist of temporalis, masseter, medial pterygoid and lateral pterygoid muscles. And the temporalis muscle, it is situated in the temporal fossa. That's why it is named as temporalis. Now similarly, masseter muscle, it is in the cheek area. Okay, so these in the cheek area. Then medial pterygoid and lateral pterygoid, they lie in the infratemporal fossa. So these are our 4 masticatory muscles. Okay, now we'll describe each one of these in detail. So let me show you the muscles first. So temporalis muscle, this is the temporal fossa and this is the temporalis muscle. So in this image, they are telling you the nerve supply of the muscles of mastication. So this is the mandibular nerve, the one which I'm marking. It's yellow. If I'm marking, it is getting red. So you can see this. Okay, this yellow, this is the mandibular nerve and this is the deep temporal nerve. Now masticatory muscles, they are innervated by the mandibular branch of trigeminal nerve, that is mandibular nerve. So basically trigeminal nerve, they have 3 parts, namely ophthalmic, maxillary and mandibular. Now here itself I would like to tell you one very important point. So before that, this is also highly important, and examiner can ask you this question in viva. Now muscles of mastication, they can be broadly divided into primary muscles and secondary muscle. Now when I'm saying primary muscles are masseter, temporalis, lateral pterygoid and medial pterygoid. Now the secondary, so secondary muscles or accessory muscles, they are buccinator. Okay, buccinator muscle. If examiner is asking you this question, what are the secondary muscles of mastication, so you should know the names. Then second is suprahyoid. So as the name indicates, suprahyoid, that is above the hyoid bone. So what are the muscles present above the hyoid bone? They are digastric muscle, then mylohyoid muscle, then genohyoid muscle. So these 3 muscles along with the buccinator muscles, these are the secondary or the accessory muscles. So examiner can ask you, namely define the primary muscles of mastication, or how would you classify the muscles of mastication. So you should tell them that there are 2 groups. First is primary and second is secondary group or accessory group. Now here in this lecture, we would be covering primary muscles of mastication. So let's start with the lateral pterygoid muscle first. Now for any muscle, you are supposed to tell 3 things. First is origin, then second is insertion, then third is action. So origin of lateral pterygoid, so it is originating from here. Okay, originating from the infratemporal fossa of the greater wing of sphenoid bone and partly from the lateral plate of pterygoid process. So they have 2 heads like this. So first one, it is originating from the greater wing of sphenoid bone, and second is from the lateral plate of pterygoid process. Now the insertion, so insertion is on the pterygoid fossa of the mandible. Okay, here. Now what is the action of lateral pterygoid muscle? So on bilateral contraction, it pushes the mandible forward. On unilateral contraction, it pushes the mandible to the opposite side and it is responsible for the depression of the mandible. So again, I am repeating, for any muscle, you're supposed to know 3 points. First is origin, insertion and action. Then second muscle is medial pterygoid muscle. So again, the origin is from the pterygoid fossa of the sphenoid bone here. Now insertion is on the pterygoid tuberosity of the mandible, that is on the inner aspect of the mandible. Now what is the action of medial pterygoid? So on bilateral contraction, it pushes the mandible forward. On unilateral contraction, it pushes the mandible to opposite side and elevation of the mandible. What was lateral pterygoid doing? Depression of the mandible, and this is responsible for the elevation of the mandible. Then next coming on to temporalis muscle. So again, origin is from the temporal plane of side of the cranium. So this is the origin of the temporalis muscle. Now insertion is on the coronoid process of the mandible by medially to zygomatic muscle. Okay, so this is the mandible, this is the coronoid process, and the insertion of the temporalis muscle is on the coronoid process of the mandible. Action of this muscle is elevation of the mandible and retraction of the mandible. Then next coming on to next muscle, masseter muscle. So origin is from the zygomatic arch. So this is the zygomatic arch, and again it is divided into 3 parts. Okay, so anterior 1/3 is from the inferior surface of the zygomatic arch. Then the next 2/3 is from the inner aspect of the zygomatic arch. Insertion is on the masseteric tuberosity of the mandible. Then action is elevation of the mandible. Now the only muscle which is responsible for the depression of the mandible is lateral pterygoid. Rest all the muscles, they are responsible for the elevation of the mandible. Now again, this is an important viva question. Now let's brief the movements of the mandible, or you can say the movements of the muscle. So elevation, muscle of mastication responsible for this is all except lateral pterygoid. And lateral pterygoid, it is responsible for the depression. So for the depression, there are lateral pterygoid muscle and again suprahyoid muscle. So suprahyoid muscles, they are the accessory or the secondary muscles, and they are namely as digastric muscle, mylohyoid muscle and genohyoid muscle. Then for protraction, all of the muscles of mastication are responsible except for temporalis. Then retraction, posterior fibers of the temporalis muscle. So this was all about muscles of mastication, and this complete topic, it is highly important from exam point of view, and often long note is asked on muscles of mastication. Also this topic is important from viva point of view. Thank you.